My dear doctors, so today I've come with yet another case for the Mrcp PACES consultation station. I put the heading is CML, but normally this case can present either with splenomegaly or lymphadenopathy in your consultation station. So let's start our case. So this is your case scenario. Mr. Smith, a 50-year-old male, he presents to the clinic with fatigue, unintentional weight loss, and frequent episodes of night sweats over the past few months. He reports feeling increasingly tired despite maintaining a regular sleep schedule. Upon further inquiry, he mentioned occasional bone pain, particularly in his hips and ribs, and he denies any recent infection or significant medical history. So again, as I told you that you have 5 minutes once you read the case scenario. So in these 5 minutes, you brainstorm and try to think about all the differential diagnoses which are possible in this case. So it has already mentioned here that it's got fatigue and weight loss, and there is also night sweats. So these are actually the buzzwords. So we'll be thinking about some malignancies or something chronic going on. Okay, let's move on. So in the history, you're going to obviously inquire about the duration and the progression of symptoms. So inquire about the duration of symptoms like fatigue, unintentional weight loss, and night sweats. And obviously we want to know whether these symptoms are present for weeks to months and if they have been progressively worsening. Presence of bone pain or other symptoms. So explore the presence and characteristics of bone pain, particularly in weight-bearing bones like hips and ribs, and determine if the pain is dull, aching, or sharp, and if it is exacerbated by movement or rest. Past medical history is very important in your history. So obtain information about any previous diagnosis or treatments for hematological disorders, cancers, or other chronic conditions. And also very important, you note any history of exposure to radiation or toxins. In the family history, inquire about a family history of hematological disorders, including leukemias, lymphomas, or myeloproliferative neoplasms, and any genetic predisposition or familial clustering of blood cancers. So this family history is very important. Coming to the medication history, we review the patient's current medications, including the prescription drugs, over-the-counter medications, and supplements, and pay attention to any recent changes or addition to the medication regimen. Social history, we like to explore the patient occupation, about the lifestyle habits and exposure to environmental factors. Inquire about tobacco use, alcohol consumption, and occupational exposure to chemicals or radiation. Symptom-specific inquiries ask about specific symptoms such as early satiety, any abdominal discomfort or fullness due to splenomegaly. Inquire about symptoms of thrombocytopenia like easy bruising, bleeding, gums, or petechiae. In the system review, perform a comprehensive review of systems to identify any additional symptoms or constitutional symptoms that may be indicated of CML or any associated complications. So this may include the respiratory symptoms, about the neurological symptoms or gastrointestinal symptoms. So in the system review, ask 2 or 3 questions about all the systems. So once you have taken the history, then you're going to take consent and proceed with your focused examination. So general examination will be looking at the pallor, maybe because of the anemia. Look for only lymph nodes enlarged. So it can be in various regions. So suggesting the systemic involvements, and obviously we want to do the cardiovascular examination and mainly looking for the hepatosplenomegaly. And these, as we know, that liver spleen may be enlarged due to extramedullary hematopoiesis, and which is a characteristic feature of CML. In the musculoskeletal examination, we look for any bone tenderness, Patient may experience bone pain or tenderness, especially weight-bearing bones like hips and ribs due to bone marrow expansion, and any skeletal deformities. Advanced stages, rarely the skeletal deformities can present, particularly if the patient is in the blast phase. Cardiovascular examinations will look for any anemia. So signs of anemia normally include some tachycardia, palpitations, and low blood pressure, and also auscultate for any cardiac murmurs, which either could be maybe anemia-induced flow murmurs or any associated cardiac complications. In the respiratory examinations, we look for any tachypnea or dyspnea on exertion, or any rales or crackles. There may be pulmonary congestion due to leukostosis or leukemic infiltration. In the neurological examination, we'll be focusing on cognitive function, so assessment of may reveal signs of fatigue, lethargy, or impaired concentration, which are common symptoms of anemia and systemic illness, and look for any focal neurological signs like weakness, sensory disturbances, or any cranial palsies, cranial palsies. And skin examination, again, we look for pallor, look for any petechiae or ecchymycosis. They may observe because thrombocytopenia, which can occur secondary to bone marrow suppression or splenic sequestration. Abdominal examination, I already mentioned hepatomegaly and splenomegaly, very important. And this one I have focused, I have put the diagnosis CML, but in the examination, maybe you're not knowing, you will get only the positive findings like hepatomegaly or splenomegaly. So you should know all the differential diagnoses and causes of hepatomegaly and splenomegaly. And CML can be one of the diagnoses if you've got massive splenomegaly. So what are the differential diagnoses? So it can be CML, it can be other myeloproliferative neoplasms like polycythemia vera or essential thrombocytopenia. Secondary causes of leukocytosis, infection or inflammation, lymphoproliferative disorders like lymphomas or metastatic bone disease or other malignancies. So it could be actually anything. So management plan, we want to confirm the diagnosis. So we want to do the bone marrow examination and molecular testing. If we are thinking about the CML, then we can start the tyrosine kinase inhibitor therapy such as imitinib, which is the first line treatment for CML. And we want to regularly monitor the response to therapy through CBC, peripheral blood smear, and quantitative PCR for BCR ABL transcript level. And obviously, we have to do some symptomatic management of associated symptoms like pain relief for bone pain or supportive care for fatigue, and can consideration of hematopoietic stem cell transplantation for eligible patients with refractory or advanced disease. And patient education is important regarding the chronic nature of the disease, and to discuss with the patient the treatment goals and potential side effects of therapy. So here is our case presentation. So once you've done your history and examination, you have to do the case presentation. This is one of the way how you can do it. So Mr. Smith, 50-year-old male with fatigue, presented with fatigue, weight loss, night sweats, and bone pain for several months, no significant past medical history. Again, you will divide your presentation into the history, and then you talk about some examination findings. In the examination, patient have positive findings like pallor, hepatosplenomegaly, bone tenderness, and tachypnea. No focal neurological deficit or murmurs. Important negative also mentioned. Investigations, you just suggest CBC, peripheral smear, bone marrow biopsy, molecular testing for BCR, ABL, fusion gene, imaging studies, and differential diagnosis, CML or other myeloproliferative disorders, maybe secondary cause of leukocytosis, lymphoproliferative disorders, metastatic bone disease. And the management plan, we confirm the diagnosis with bone marrow examination and molecular testing. So initiate the tyrosine kinase inhibitor therapy, imitinib, and monitor the treatment response. And we manage the associated symptoms. And especially we're thinking about CML, we can consider the hematopoietic stem cell transplantation for eligible patients. So this is how you're going to present your case. Always present your case in a systematic way. Start with the history, give some examination findings, suggested investigation, your differential diagnosis, and finally your management plan. Here I put some of the questions which could be asked in the Mrcp PACES. What are the typical presenting symptoms of CML? So typical symptoms usually include fatigue and unintentional weight loss, night sweats, bone pain, and splenomegaly or hepatomegaly. How would you confirm the diagnosis of CML? So it is usually confirmed through bone marrow aspiration and biopsy, and they will normally show increased number of granulocytes of various stages of maturation, and molecular testing for the presence of BCR-ABL fusion gene, which is also essential. What is the significance of Philadelphia chromosome in diagnosis of CML? So first of all, we should know that Philadelphia chromosome, it is a reciprocal translocation between chromosome 9 and 22, and it leads to the formation of BCR-ABL fusion gene. And this genetic abnormality is characteristic of CML and plays a central role in pathogenesis. First line treatment for CML, and how does it work? The first line, we know it is a tyrosine kinase inhibitor therapy, such as imatinib, and it works by inhibiting the activity of BCR-ABL tyrosine kinase gene. So therefore, blocking the aberrant signaling pathway that drive the proliferation of leukemic cells. Goals of treatment, CML, and how do you monitor response? The goals are to achieve and maintain deep molecular remission, and we want to prevent the disease progression and improve overall survival. So it is monitored through regular assessment of complete blood count, peripheral blood smear, and quantitative PCR for BCR-ABL transcript levels. Considering the potential complications or side effects of tyrosine kinase inhibitor therapy, so potential complications include myelosuppressions, which can present with neutropenia and thrombocytopenia. We have also got some gastrointestinal symptoms like nausea and diarrhea, fluid retention, hepatotoxicity, cardiovascular events. So, and then the long-term monitoring for potential development of resistance to TKI is also important. So, how do you approach the management of respiratory symptoms such as bone pain or fatigue in patients with CML? So, management of respiratory symptoms usually involves symptomatic relief through analgesics for bone pain and supportive care measures for fatigue, including adequate hydration, rest, and nutritional support. And in some cases, additional interventions like physical therapy or psychological support may be beneficial. And finally, what are the indications for hematopoietic stem cell transplant in CML, and what factors influence the decision to proceed with the hematopoietic stem cell transplantation? So it can be considered who have failed or are intolerant to TKI therapy, or in those with advanced or blast phase disease. So factors influencing the decision to proceed with the HSCT include patient age, comorbidities, disease stage, and availability of suitable donors. So this is all about the CML. Actually, this case I have put CML here because it has presented recently in one of the Mrcp PACES examination. So normally you'll get the patient who have some history which is suggestive of some malignancy, and then once you found the splenomegaly, massive splenomegaly, then you'll think about the causes of the massive splenomegaly, and maybe the examiner will then direct you towards the CML and ask you more questions or more in-depth, check your in-depth knowledge about the CML. So that's why I put this case. Hopefully it will help you in your Mrcp PACES examination. Thank you very much, and I'll see you in my next presentation.